Hello everyone, as we continue our series on lower back problems and lower back pain, we come to the joints. Now we do have joints in the lower back, just like you think about joints elsewhere in your body. Now it's important to understand that joints are surrounded by a capsule, which is a bit like chewing gum if you like, around your joint, and inside of them you have this synovial type fluid which lubricates and helps to keep your joints fluid. Now we do have joints in the lower back, but they differ as you move from the neck through into your mid-spine and down into your lower back. There's a picture up here which shows you the difference between those particular joints. And I'm going to explain it in a little bit more detail. Now, in your mid-spine or your upper back, which is called your thoracic spine, the joints actually slide and glide very smoothly in all three planes of motion that your body is capable of doing. So forward and backwards, side to side, and very importantly, and this is the one we need to note, rotational motions, which actually the upper or mid-spine is quite good at doing. The problems happen because we're quite restricted in our sitting jobs or our kind of lifestyle on our phones and our laptops, which restrict this mid-spine and doesn't allow these type of motions to occur there. And what tends to happen is the body then transmits those forces either lower down to your lower back or up to your upper neck and your spine in your neck. Now, why does it cause problems when it does transmit into the lower back? That's because, and you won't be able to see this as clearly, but I will show you as close as I can, and a picture will pop up just over here. But the joint in the lower back is slightly different shape compared to the upper back, and so it does allow flexion or forward bending and backward bending quite well, and to an extent and degree it does allow quite good side bending and side shifting, but it's got very little rotation because of the shape. You can just see there, because of the shape of the joint there. It's very important that little rotation is helpful in transmitting forces through the spine. However, if the lower back has to do too much work, which it does have to do if the upper spine is not working very well, and especially if the hips are not working very well, then what tends to happen is you get this banging or knocking effect of the joint, and it starts to irritate this joint. It's known as facet joint irritation or facet joint inflammation, and sometimes that can create a locking type feeling, an irritated local point of pain just around the area of discomfort on the side of your spine, so not directly in the middle but just to the side of the spine. And when you extend back and try to bend to the side of pain, it causes a lot of discomfort, and bending back is much worse than when you have to lean forward. A lot of people feel like when they lean forward it relieves that pain. It feels much more comfortable if they have a joint irritation. And as we said in all of our series on lower back pain, we've got to understand the root cause. Upstairs is the upper back working, functioning well. Downstairs is the hip and the pelvis functioning well. And to be honest, we need to go all the way down to the foot and the ankle to know whether that's creating this transmission of force, which is creating too much rotation at the lower back and causing your joint to be irritated. So I hope that's helpful. Once again, please join our masterclass on lower back pain. The link is below, and you can give us a call at any time. We're happy to discuss your case and happy to discuss if this is something that you're suffering from.